Welcome to our demonstration of the Kimberly-Clark KimVent Multi-Access Port Closed Suction System and the KimVent Balcath Bronchial Aspirate Sampling Catheter. The demonstration you are about to see applies to the following family of products: KimVent Multi-Access Port Closed Suction Catheter, KimVent Multi-Access Port Closed Suction System Wet Pack, KimVent Multi-Access Port Closed Suction Replacement Catheter, and the KimVent Balcath Bronchial Aspirate Sampling Catheter. Currently, in order to perform additional procedures on ventilated patients, such as bronchoalveolar lavage, bronchoscopy, or drug delivery, clinicians have had to break the ventilator circuit, exposing the patient to contamination from outside pathogens, a leading cause of ventilator-associated pneumonia. This also can expose the caregiver to pathogens from the patient. But with KimVent Multi-Access Port Closed Suction System, the compact rotating manifold provides multiple ports to access the patient's airway, locking into place with a click. This reassures that the circuit remains sealed, enabling catheter replacement without opening the circuit. The single-use seal cassette maintains PEEP during insertion of a sampling catheter or other devices, so both suctioning and alternate procedures can be performed while maintaining a closed vent circuit. Before setting up the procedure, wash your hands according to your unit protocol. To set up the procedure, first select the appropriate size KimVent MAP closed suction catheter. To calculate the correct size catheter, multiply the endotracheal tube diameter by 2. In this case, 6 millimeters times 2 equals 12. Then use the next smallest size catheter, which in this case would be a 10 French. The size of the catheter can be found in the catheter size selection zone located on the upper right-hand corner of the KimVent Multi-Access Port Closed Suction System packaging label. Furthermore, the size is indicated by color. Specifically, each corresponds to the French size and is in compliance with the international standard. Next, attach the thumb control valve to the suction tubing. Depress and hold the thumb valve and simultaneously adjust the vacuum regulator to the desired level. Then release the thumb control valve and attach the KimVent MAP closed suction catheter between the patient and the ventilator circuit. Stabilize the catheter in the artificial airway with one hand. Ensure that the catheter is in line with the artificial airway. Depress the plunger button and rotate the KimVent MAP closed suction manifold if necessary. Be sure that the black marking ring is visible inside the sleeve. Open the cap on the irrigation port. Insert the saline vial into the irrigation port. Advance the catheter to the desired depth in the artificial airway using your thumb and forefinger of your opposite hand. Depress and hold the thumb control valve, then gently withdraw the catheter. The tethered sleeve, which provides a stop when retracting the catheter, therefore prevents over-retraction that leads to the inflation of the sleeve. Stop withdrawal when the black marking ring is visible inside the sleeve. Release the thumb control valve and repeat the previous steps as necessary. Lock the thumb control valve when not suctioning to prevent inadvertent or accidental activation. The lock graphic provides a clear indication that the suctioning thumb valve cannot be depressed. Intermittently depress and release the thumb valve until the catheter and chamber are clear or until the vial is empty. Lock the thumb control valve when not suctioning to prevent inadvertent or accidental activation. Align any printed depth number on the catheter with the similar number printed on the endotracheal tube. In this case, 30 centimeters on the catheter will line up with 30 centimeters on the endotracheal tube. Or, observe the printed number on the endotracheal tube closest to the endotracheal tube adapter. Add 6 centimeters. In this case, 30 centimeters on the endotracheal tube plus 6 centimeters equals 36 centimeters. Advance the catheter until the sum appears in the window of the KimVent MAP closed suction manifold. The catheter tip will be within 1 centimeter of the end of the artificial airway. Next, we will demonstrate the use of the alternate therapy port using the KimVent Balcath bronchial aspirate sampling catheter, which is designed to be compatible with the KimVent multi-access port closed suction systems, enabling clinicians to quickly and safely obtain a lower respiratory tract sample on mechanically ventilated patients without opening the ventilator circuit. Remember to use a sterile technique when performing the procedure. Before setting up the procedure, wash your hands according to your unit protocol. It's also recommended that you wear protective measures such as gowns, face masks, and gloves. To use the KimVent Balcath bronchial aspirate sampling catheter, depress the plunger button and rotate the KimVent MAP closed suction manifold so the alternate therapy port is in line with the airway. Attach the sterile suction tubing to the sputum trap with suction tubing to wall suction. Attach the sputum trap. Attach the suction adapter to the three-way stopcock on the inner catheter. Attach the suction tubing to the suction adapter. Close the stopcock to suction. Attach the syringe to other port on three-way stopcock. After removing the Balcath from the package, remove the protective clip from tip of the Balcath catheter. Open the cap of the seal cassette on the KimVent MAP. Remove the Balcath adapter from the package and attach to the seal cassette. The seal cassette aids in the maintenance of PEEP throughout the procedure. Insert the Balcath through the Balcath adapter into the seal cassette, keeping the tip sterile. Position the curve of the directional tip catheter